Hi. Now, I've talked about the definition of menopause already and the different common symptoms that women usually feel. Let's now talk about the treatment. Okay, I will divide my discussion into three parts, namely the treatment using synthetic medicines. Number two, the treatment using supplements. And number three, treatment using natural remedies or lifestyle changes. Okay, so let's talk about synthetic treatments first. These are composed of medications that actually now replace or replenish the hormones that are already declining during the menopause, namely the estrogen and the progesterone. Now, there are two preparations in the market, the estrogen only preparation and the combination preparation of estrogen and progesterone. Usually, the combination preparation of estrogen and progesterone are given to women who still have their uterus and are in the menopause already. And the estrogen only preparation is given to women who have undergone surgery like total abdominal hysterectomy with bilateral salpingo-oophorectomy, and they don't have actually the need of the supplementary or the complementary effects of both hormones in the medication. So these medicines are usually started early on, like some actually doctors started during the perimenopause, wherein during the time that women actually start experiencing all the symptoms of menopause. And we continue for a couple of years. Now, monitoring is very important. You still have to undergo your pap smear. You have to have your blood tests, and you have to have your ultrasound. So it's best that you see your doctor about this, and we can actually now assess which treatment option is best for you. Okay. When it comes to natural remedies, there are a lot of self-help articles and videos out there that are available. However, the bottom line of natural remedy is a well-balanced meal and a well-balanced lifestyle. Okay, what do I mean by this? You have to have your vegetables, your sources of protein, your sources of carbohydrates. Dieting too much during the menopause may be detrimental instead of helping you more, or instead of being beneficial. You need a little, so becoming too thin during the menopause may make you actually more prone to developing osteoporosis. So we need that little weight during the menopause to help strengthen our bones. Okay? Decrease your intake of caffeine, because this will actually make you more prone to osteoporosis. Instead, shift to drinking milk or eating or consuming sources of calcium in your diet. So that's very, very important for you now, because menopausal women have this tendency to become a little more at risk of developing fractures. Okay. How else can you strengthen your bone? Engage in actually low impact to moderate impact exercises. You can actually go dancing. So this is the time that you can go ballroom dancing, or you can actually do some aerobic exercises that are low impact. You can actually, if you have actually an access to a pool, then swimming is also very advisable, and then yoga is also very good. So there are a lot of actually exercises that that you can actually do. However, we can't be too careful in terms of engaging in extreme activities that may actually make you more at risk in actually getting involved in accidents and eventually having a fracture. So you have to also be very, very careful. All right, aside from that, I guess if you're having hot flushes, it's common sense, I think, that you actually wear a looser fitting clothing. Aside from that, you can drink a lot of water, okay? Consuming at least 3 liters of water a day. That's excluding all the other beverages that you're drinking, is also advisable during the menopause, as well as actually any age. Hydration is key to good health. Remember that. Okay, it's also very important that you get enough sleep. Getting 6 to 8 hours of sleep a day is still actually key to also feeling good, lessening your irritation and anxiety because you're tired, just because you didn't get to sleep enough. So if you can't really, get that straight 6 to 8 hours of sleep in the evening, you can actually take naps in the afternoon, like one in the midday and one in the mid-afternoon. So you can also do that. Like a 30-minute nap will actually also help. And finally, of course, staying in touch with your family and friends, especially during this pandemic, wherein, you know, the isolation that it actually brings may cause more anxiety and more depression, especially when you're undergoing all these fluctuations in your hormones and all these changes in your body that are actually, you know, kind of confusing. So it's very important that you still try to reach out to people. I don't mean going out of the house. You can just actually call them. You can go video calls through Viber or through Messenger, or you can do Zoom meetings if you have an account. So you can actually still keep in touch, still, you know, and update everybody about what you're actually also busy with. So and then finally, okay, I said finally before, and this is finally, indulge or learn new things, okay? It's never too late to learn new things, because once you learn new things, and then you actually discover things that you haven't like really done before, or you haven't really given much attention to, then this can actually, you know, help you feel better, increase your endorphins, make you happier, and so the possibility of anxiety will be lessened. Let's go to supplements. Now, there are so many available supplements in the market that actually help with the menopausal symptoms. However, I personally have a favorite. This is one of the options that I give for my patients who are complaining of perimenopausal and menopausal symptoms. And it is, okay, there. It's Femoral. This is actually not just one preparation. This is the Femoral line because it has 3 variants. Okay, so let me just show you the picture. Okay, we have the Femoral Rejuvenate, the Femoral Recharge, and the Femoral Unstoppable. The Rejuvenate is usually given, I usually give this for my perimenopausal patients who complain of easy fatigability, anxiety, irritability, depression, insomnia, mood swings, sleep disturbance, and low energy. Okay? The Femoral Recharge, I give for patients who are now more symptomatic. So, those women who are in the menopause. So, those women from 50 to 60 years old, who are complaining of vasomotor symptoms, night sweats, hot flushes, anxiety, irritability, decrease in libido, joint and muscle pains, sleep disturbances, low energy and fatigue, okay, palpitations even, and depression, okay. And then finally, the Femoral Unstoppable is given, actually I give this to my patients who are in the postmenopause, so those who are older than 60, who are actually now complaining of vaginal dryness, dyspareunia or painful intercourse, urinary problems, osteoporosis, and cardiovascular diseases, and more anxiety attacks. Okay, so this is actually a very good line because menopause causes a decline in estrogen that leads to chronic hormonal imbalances, which now accompanies women from the perimenopause onwards. So what's good about this medicine or this supplement or the Femoral is it actually now targets the different stages of menopause that women experience, and there is a specific preparation for each stage. Again, the stages are perimenopause, menopause, and postmenopause. So aside from this actually yung helping out with the vasomotor symptoms, it actually also helps in maintaining the good health of your skin and your hair. So, diba? It's a total package. So, if you found this video informative, you can actually give this video some love. And also share your experiences down in the comment section below. So, with that, again, thanks for watching. Stay safe and God bless you all. Bye-bye!